Hi guys, Dr. Tony here. Today we're going to talk about lower back pain, specifically Facet Syndrome. And Facet Syndrome is spelled F-A-C-E-T. It is by far the most common cause of lower back pain, more than anything else. Now, the facet joint is a small joint that connects the bones together in the back of the spine. Now, even though this is a very small joint, there are more pain fibers inside this area than any other area of the spine. So it's very easy to irritate and compress the joint. Now, some of the causes of Facet Syndrome would be, one is as the spine is degenerating, basically as this cushion in between the bones is getting smaller and smaller, you begin to compress the spine. Now, exertion or overactivity can cause inflammation within the joint as well. Now, these can become very problematic for a lot of people. In fact, so problematic that some of your pain management doctors have to actually go in and burn the nerves in the joint, so it just quits communicating to the brain. So now what you may be experiencing with this is typically just a localized lower back problem, localized lower back pain. Now, the facet joint is unique because it can refer pain in a real broad distribution. Unlike a nerve, is you feel the pain directly down your leg. But with a Facet Syndrome, you're going to feel it mainly through the lower back, maybe down into the hips, and sometimes up into the kidney area. Now, you'll see a lot of people, what they experience and when they feel like they're getting relief from that, is if they stand in a line for a long time, they just want to bend over and open the spine back up. And essentially what that's doing now is opening the joint and taking pressure off of that area. Now, some of the things you can do at home with this, and probably one of the most important things when you're going through an acute flare-up, is to use ice. Now, the general rule is that you want to keep ice off of the spine twice as long as you keep it on. So basically what that means is if you use ice for 20 minutes, keep it off for 40. If you use it for 30 minutes, keep it off for 60. And do not go over 30 minutes because the ice will have a reverse effect at that point and will probably burn you. Another thing to keep in mind is do not use heat during an acute flare-up. That is going to inflame the area more, and although it feels really good when it's on your spine, once you take it off, this is going to come back with a vengeance, and then of course most people say, let me put the heat back on again. A few other things that we can do with this, that you can do at home. Mobility is key with this. So learning how to get into some flexibility exercises, some stretching exercises will help you on more of a long-term basis to keep this from coming back. Now, keep in mind that a lot of the Facet syndromes that we see are very, very chronic and don't respond to just at-home care. So that's why we have specialized therapies here in our office that we'll use to bring you back to a normal state, to allow it to function better, so we don't have to get to the point where the pain management doctor has to burn the nerve off into the spine.